Hi everyone, Ramadan Kareem. It's been a while since we have the chance to meet each other like this. Even though we are working in the nearest Badr Samaa centers in the Sahar region. Really, I'm happy to meet all of you today.
That's true. We are very busy lately, and it is great that we are meeting up here today to discuss something related to women's health. Let's hope that this session brings some information and awareness to the public, especially in this month of Holy Ramadan.
Ramadan is really challenging for our expectant mothers. Dr. Sundus, can you please tell your views regarding how a pregnant lady navigate their fasting during this holy month?
Well, first and foremost, we need to assess if fasting is safe for the pregnant lady and her baby. Factors such as stage of pregnancy, any existing health condition, any the overall health of the pregnant mother and her baby is a crucial factor in making this decision. At the end, if fasting is not advisable, we need to explain to the pregnant lady that there are other ways to observe the spirit of Ramadan, such as giving to charity or helping others.
Absolutely, Dr. Sundar. It's all about understanding and accepting the limitations of your body during pregnancy. Hydration is very important. A pregnant ladies must drink plenty of water between iftar and suhoor, and they should have a diet rich in proteins, vitamins, and minerals like fruits, vegetables, especially to maintain their energy levels.
Actually, we need to tell them about the signs of dehydration. For example, feeling giddiness, weakness, and headaches.
And
It's
they
not
should
just
avoid
about
some things like especially exposure to hot
sunlight and
sunlight
that's true.
and heavy work they should avoid. Better they
Dark
should
urine,
stay,
dark urine also.
or like if workplace actually also they should be careful if they have exposure to more heat and all, better actually to avoid fasting during the pregnancy
Well, it
period.
is not just that. It is very important to focus on certain breastfeeding moms who decide to breastfeed as well as fast. So they have this problem of what exactly to do. I remember one concern that one mother had approached me that she chose to breastfeed. She has a 10-month-old baby. And she was so tensed and she came to me what to do exactly. And I chose, I want to fast. I couldn't fast 2 years back, but I feel so bad. For what about this time? So then I reassured her and I told her, we sat down and made up a plan what to include in her diet when she is in that eating window, what to include so that it can increase the energy requirements and fuel up the milk production, and she can feed the baby. And she was quite a comfortable mother. At the end, she told me she took, like, she is going well enough, she doesn't have any problem. As long as it doesn't cause a problem for the baby and the mother, I think it's fine enough, isn't it?
Yes.
That
And
was really a good example,
Yeah.
Dr. Elizabeth. Actually, that proves that if actually like we are guiding them and supporting them, the pregnant lady, they can balance
continue
between their
safely.
religious views and their health needs during pregnancy and breastfeeding.
Yes.
Exactly.
And actually, we can tell her also to get plenty of rest while she is fasting hours. And if she is, and to be more careful, if she is fasting during the last 3 months of her pregnancy, as usually she will need 200 extra calories
Yeah, true.
this stage of pregnancy.
And extra precaution needed in cases like hyperemesis, then GDM mothers with uncontrolled sugars and twin pregnancies. Actually, they need a proper care, one is to one care and advice. Actually, only with our consultation and guidance, they can
Continue.
go for fasting.
I think it is okay if we just, when they approach us, so we can make a care plan for them, individualize them, what are their needs, and help them accordingly.
Yeah, it's
Isn't
not
it?
like a universal plan for everyone. Actually, it should be
We can
individual
give
plan.
a printed diet means food they should follow according to their this.
Especially the underweight pregnant
Yeah,
True,
women.
true.
malnourished people also should be careful.
I was thinking yesterday when I was like using a GPS, my route to my house was little different, so I was finding it very difficult. So I was using my GPS to find out where exactly the true location is. And I was thinking, it made me think, why can't we just have a GPS system in our own healthcare that can help us and track whether our women, whether they are in the healthy stage or not, or whether they are going to confound any problems that they should be aware about. So I was thinking about like dependable about age basis, like the young woman that they should be aware about, or the women who are in the reproductive age, that is around 30s or 40s, and the a little bit more advanced, like more than 50s. We should definitely tell them about their health related problems they can come across. Like in 20s, I was thinking that we should make them aware about, before they start their sexual life, the importance of doing a pap smear, which we do as a protocol of cervical screening. They should know more about it. They should be aware, because I meet certain times that people are not much aware about, and we should definitely tell them, maybe as a health screening. And then there are so many. I remember a case in my OP that mostly I get cases of vaginitis, that they have infections down. So they don't know much about the hygiene, or that we should do a swabbing test that will give us more idea about sexually transmitted infection, what they can do to prevent it. I think they should know more about it. Don't you think so?
Yeah, exactly, Dr. Elizabeth. As you told, that the awareness is much important actually. Like some patients we are facing in OPD, like if we are suggesting them some pap smear or mammogram, they are totally unaware of such
Yeah, true.
test actually. We have to explain what it is, what is the need, why you are like advising this test, what is the need, what is the benefit, what all risk actually, like if they are not doing that test like that. Awareness is important, and especially like here in Oman actually, like it this awareness screening test and all depends on the culture and countries.
True.
Actually, if we are like comparing with the Western European countries and all, they are like aware from their school period onwards. Actually, they are aware regarding this STIs, like a sexually transmitted infection,
Yeah.
regarding the pap smear, regarding the vaccinations, regarding mammogram. They are like totally aware, but some population they are not aware. So actually we should give like proper awareness, then like we have to prepare guidelines based on the age and all, as Dr. Elizabeth already told. Okay, and regarding the other routine, not only regarding the oncology or STIs, something like uh, general health fitness actually programs, and like health packages also good. Like in some aspects, some people actually, like especially that middle-aged ladies, actually they will be busy with their work
They
and family. So whatever they are having some symptoms like any tiredness, fatigability, lack of sleep, everything, like they will think it is because of my work, busy life and all. But sometimes it can be because of anemia
Yeah.
and thyroid issues. Recently, actually, like I had a patient. Actually, like she came just like she was telling like I'm not active as like I was before. And when I just did her RBS, thyroid and CBC, it came out like she is severely anemic plus hypothyroidism.
Yeah.
And within 1 month of treatment, actually, like all she became like
Symptoms
a
were better.
healthy lady, and totally like she was like thanking me for like doing all this screening tests for her and detecting this and managing it nicely. So we should go for those screening guidelines.
So what about the older ladies? What extra we can do for them?
Actually, I had a patient in her 50s who was actually surprised to find out that she had osteoporosis through simple bone density tests. Early detection truly can lead to better outcomes. It's like a sneak peek into your health future.
Actually, all these screening tests and early warning signs that we can pick up them early, means we can identify them early, which we can easily treat and manage them. If you are finding it late, it will be difficult to manage and treat these patients. And this screening test is all regarding finding the early warning signs and identifying them, and they can be easily treated.
I mean, it is always better like you prevent it rather than curing it, isn't it?
And for our OPD patients, actually, we can give an advice. They will be coming for something else, some minor issues and all. During the visit, we can actually just give them some health awareness class regarding all these guidelines regarding the health screening, pap smear screening, breast cancer screening, and plus general health awareness.
Actually, also human papilloma virus testing, In our OPD, how many patients? Many patients, they are coming with genital warts, and there is no, any awareness about human papilloma virus vaccine. This program is not applicable, I think, properly in Oman.
And we can advise them that if they are having a girl child, as early as possible, they can vaccinate their children also.
Yeah. Actually, I am one doctor. He's working in Sahar Hospital. He come and he asked me, my daughter, she's 11-year-old. Please, doctor, give her human papilloma virus vaccine. Because it's, I was surprised, and he was telling me, he know me, so he told me, why you are not giving your daughter also almost 11 years. Even me, I was thinking, really, we are not thinking about this, because we can, by this vaccine, we can prevent serious problem.
And actually, one suggestion, actually, we can discuss with our management, and we can go for some clinics, actually, specifically age related, like adolescent clinic, postmenopause clinic, like that. So actually, that bulk of patients coming to the OPD, actually, it will be like some channelized.
Yeah, they'll be
It will be
streamlined
easy to
actually.
handle that patients, actually. Like we can properly tell them what all guidelines, what all tests recommended.
How frequently they should do that, like that.
Occasionally, we can plan for something like that.
Let's just talk about exercise, something we can relate to. Keeping our body active isn't just making our body well, it is also about good for our mind. Don't you think so? Dr. Sabiha, can you share something about how do you keep yourself active and healthy?
For me, the main thing, actually, we should be happy while doing exercise. Whatever it is, whether it is yoga, Zumba, aerobics, or brisk walking, the key point is actually we should get involved into it and we should be happy, so that it will be like a dual effect. It will be like for health benefit and for mental relaxation. And most of the exercise, not most, all exercises, actually, it will release good hormones or good chemicals in our brain, and it will be like a natural mood stimulator. And we will become energetic if we are like following good exercise schedule, daily routine exercise and all.
True. Exactly, Dr. Sabiha. Actually, I'm always telling people to choose activities which make them happy. Even love can count as an exercise. So please don't forget to have a good chuckle every day.
Especially for moms to be that women who are planning pregnancy, it's important to have a healthy body, especially because in pregnancy they will be, if they are overweight, there will be more chance of having diabetes, hypertension, etc. So for women who are planning pregnancy, they should exercise regularly to maintain their body health. And also in pregnancy, we have there is a lot of changes in our body. They can't do workouts like before. Only in pregnancy, what they can do is a gentle yoga or a brisk walk, like that. But in pregnancy also, even a brisk walk can, change a lot of thing in your mind and your body.
But at the same time, we should always tell them that they need to be hydrated as well, maintain a balanced diet, and then go in hand. So it doesn't matter whether you're a working woman or whether you're doing a gym at home or whether you're taking care of your baby. You have to just move.
In pregnancy, it is better that, every pregnant woman can have, even from the early pregnancy, they can have a walk 30 minutes in the morning and 30 minutes, brisk walking, 30 minutes in the morning and 30 minutes in the evening. Every pregnant woman can follow that.
Actually, obesity is a problem, and we are noticing obesity in teenage. Many teenage girls, their parents, they are bringing her to our OPDs, and when you are looking them, they are only 11 years or 10 years, and they are looking as if they are, 19 years, something, 14, something. They are bigger than their age. And when they have some started menstruation, some irregularity, and when we are doing investigation and ultrasound, we are finding polycystic ovaries early, starting in teenage. All because of unhealthy diet,
Lifestyle.
not doing lifestyle. Yes, correct. Not doing proper exercise, only sitting at home and
And
taking
mainly because
unhealthy
of this
food.
gadget use, actually. Nowadays, actually, like even kids, they are not playing outside. Actually, play means actually it's not an exercise.
And this is another
For
thing,
the-
Dr. Sabiha. These, electronic games, it will cause for them, anxiety, I feel. And this anxiety, they are finding it's the cause of eating more and more.
Binge eating, yeah.
Yeah.
They're
Some,
mostly on
and-
fat foods, actually, mostly. Don't
And
you
same
think so?
problem with
Yes.
this pregnant ladies also. Actually,
Yeah.
like some ladies, we will advise to avoid heavy work or exertional activities, but we are not advising majority of the
against.
ladies any bed rest or anything. But most of the ladies, they won't do any physical activities.
Yes.
They will be using all these gadgets, phones, or
They are thinking this is better for
sedentary.
their babies.
And it
also,
will affect them.
young age girls usually come to OP with regular cycles. They may be within the BMI, normal BMI, but they may be having a sedentary lifestyle. Okay, even though they are not obese, they should have a healthy, a regular exercise habit for them. They may think, they may be telling us, no, doctor, it's, we are having normal weight. Then what? Then why this is happening to us? We are not obese. Even then, we are having like irregular periods and irregular periods, PCOS, like that. Even though they are having a normal BMI, they should have a regular exercise habit for them.
Yeah, there is a misconception. If we
Yeah.
are having like normal BMA or if we are thin means
There
we
is
are
no
healthy.
need for exercise
Actually,
like that.
we
They
should
will think
tell
they
actually
will.
like exercise is not just for decreasing the weight.
Weight. Yes,
It
yes.
is for the health and well-being of the people.
And also, that little exercise, even a little exercise can maintain your normal hormone levels.
True. It is not just we should tell them more about this fast food and the junk food and this aerated drinks that they have. They have to, I mean, like cut down to the limit that why don't they just enjoy the home food?
All these things will add on to the fat content of your body only.
True, 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 very true. So I think we should work on those things and
Yeah.
explain
Advise
them,
them, yeah.
mostly those age groups, and tell them the actual benefits of doing exercises and how they will be enjoying it in the future and will not anticipate any such kind of problems, isn't it?
If they're doing it on a regular basis, they won't
True.
feel the burden.
True, true.
If we are sitting there, my BMI is okay, and if I gain more weight, then I can exercise. Don't think like that.
But I think
then it
they
will be a
are-
burden for them.
I think they are burdened out with the type of exercises that has been showed on like
Yeah.
certain whether they have to join a gym or not gym. I think we can just tell
Simple
them to get access
exercise.
to the
Whatever
YouTube.
actually they
Simple
like.
exercise,
If
yes.
someone actually like they like to play badminton, actually
why
they can
not?
play badminton. Actually, they no need to join any gym for workouts and all.
True.
But they
Maybe,
can like just
maybe
follow
we
that.
can make some programs even for the school student to explain for them about the importance of the exercise and the burden of obesity on
Yeah,
their
from younger
health.
age, they should be tuned
Yes.
regarding the need for exercise, healthy lifestyle. And all.
Exactly.
So I think we can conduct some camps or visit the
Yes,
schools or
yes,
the colleges
yes,
and
we can.
explain them about this
We can,
also.
we
So
can
that it
actually.
will be a part of their life.
Yes.
As if we are eating, drinking, sleeping, exercise should be a part of their
Yeah.
life.
True.
Actually, we can, as you said, we can plan to go to some schools and we can explain to them the importance of exercise.
And if the kids in a home can do it together, even similar age group can do it together, then it will be, it will be a
habit.
painful
It will be
thing for
like a
them.
It's a
fun,
habit, yeah.
fun
Yeah.
time.
So I think the mothers can
They
also
won't
join
feel
in.
the burden.
isn't
Family
it?
exercise,
They can
yes,
join
like they will have like fun time together.
Yes,
Yes, yes, true.
It's actually like important nowadays. Like a husband and wife will be working, and plus school and all. They will be like busy with their schedules. So some family exercise time also.
Yes.
will
And
be
they'll like
It will
also.
be very
they'll
healthy, huh? Even for the relation of between the family,
bonding.
it will be very important.
I think the most important thing for the awareness is, the hygiene, the menstrual hygiene that they need to keep. Because I have seen so many cases of, infections because they don't know about the hygiene. In spite of they using the right product, the right, I mean, like cleansers and everything, the right pads, but yet they don't know in a simpler way how they can avoid. such infections. Like just by changing the pads at the correct time can just prevent an infection, don't you think so? So telling them all those things is also important. So what about like we just give them awareness when they come with some other complaint, when we examine them, tell them which pad do you use, when do you use, when do you change it, tell them a little bit what you can, you know, this can prevent. And if at all you have infection, what are the alarming signs, you know, discharges will be this color, there will be foul smell, and then accordingly navigate through the culture test or maybe investigation and then treating them. But why not just prevent them rather than just going ahead with curing, isn't it?
Yeah, actually, we are
Exactly,
also
Anand.
a part of that thing. Actually, some cases, recurrent vaginal infection, recurrent candidiasis and all, we will give medications and we will go for swabs and all, but we won't take time to advise regarding the menstrual hygiene measures and all. So, we
Because the
should,
prime important thing is they don't understand where they are wrong, why the infection is happening.
And I once had a patient who was a bit shy about discussing her menstrual problem. But after we talked about it openly, she realized that she was not alone. And we could together not only improve her menstrual health, but boosted her confidence and, quality of life.
friendly towards our patient.
Yeah,
Then
yeah.
only like they will open
They should
all
be
these issues.
comfortable with us.
To tell each detail, and this is important.
Mainly the adolescent kids actually, like they will be shy
They don't
definitely.
talk
They
easily.
won't talk. And even to their mothers, they won't tell what's happening and all. So some kids, they have a habit of changing the pads only if it is soaked fully. That's actually like totally wrong. We have to specifically advise them.
Yeah, it will be a good media for growth of infection.
And it's all about like breaking the taboo and opening about your issues yet that you have told already, because most of them are shy, especially in a small girls, no, they will be very shy, they will be thinking it is normal. When they are going to school, so it will be difficult, they will be shy while changing the pads and all. And if we can educate them, and for mothers who are coming to our OPD, for them we can tell them, okay, and they should ask more questions regarding this issues, like their menstrual hygiene and everything. And also, like, they can ask whenever they need help, they can ask questions to us, no. And anytime we are here to
And
support
same
them.
regarding the sexual health also.
Yeah.
Concerning the sexual health, actually, like there will be like it will be a natural thing that they will have lots of questions and concerns, and we are supposed to answer all these issues in a friendly way. And lot, especially this newly wedded couples, actually, like they will be bit shy. Even to come for the consultation, actually, they will be reluctant.
I have some patient that she will sit quiet. She will not tell what's her problem and let her husband to talk.
Yeah,
She's looking to her husband and waiting for him to tell what she is feeling.
They will come with their mother or mother-in-law, and they should speak up.
Yeah, correct.
And also, the newly married couples, more chance of urinary tract infections are there, so we should educate them regarding that too.
So I think indeed it was a very good session. Indeed, we talked about so many things, about the diet, about the health, about breastfeeding, about
exercise.
hygiene, about exercise. So I think it was a good meet. We should always meet often, isn't it? Okay, thank you so
Enjoyed
much.
so much.
Okay, thank you.
Okay,
Thank
thank
you.
you.